We have all heard the horror stories about shingles, the nerve pain, the rash, and even the treatment. But what a lot of people don't talk about is the pain some people get when the rash goes away and life goes on. Well, joining us now is Dr. Christina Captain with the Sarasota Center for Acupuncture and Nutrition with more on Postherpetic Neuralgia. Is that how, am I saying it correctly?
You are.
I should say it correctly because I actually suffer from this.
Wow.
And we're going to talk about more. I'm going to make it more about me in just a moment, but let's talk about everybody else. Let's talk about this. What exactly is this?
So postherpetic neuralgia occurs usually after a case of shingles. And so what is shingles? Shingles is herpes zoster. That's the virus, the name of the virus that causes shingles. And shingles, the way that it comes about is, first of all, you had to have had chickenpox as a child. Right. And you possibly did or didn't have the vaccine. It really doesn't matter. You can still get shingles even though you had the vaccine. No, even the shingles vaccine, you can still get shingles. Vaccines just reduce the duration and severity of cases, right? So you had chickenpox, now you're an adult. Everything comes as a perfect storm, stress, maybe overindulgence in alcohol and all these kinds of things. And then this virus that is dormant in our nervous system begins to show itself and infect the body again. And what happens first is pain. Typically, pain can be in several different distributions. A lot of time it's in the low back or in the mid back. And when that happens, people say, oh, it's just a back issue. I'm gonna go to a chiropractor, get an adjusted, I'm gonna get a massage, maybe I even get acupuncture. Right. So what you have to watch out for with this is that it's a pretty severe burning pain. It's not just a sore pain. And then after that, the rash comes. When the rash comes, you know it's shingles, okay? And that distribution can be, like I said, in the back, the upper back or lower back. The most dangerous distribution is in the head and neck where it can reach your eye. And in that case, it is absolutely so vitally important that you get right away to an ophthalmologist and get your eyes assessed and get treatment immediately for the shingles.
And so why do some people suffer long-term from this, from the neuropathy after shingles, and some people don't?
Well, so for the first thing, getting to the doctor right away and getting on your antivirals. This is a case where we have to integrate Western and Eastern medicine together. Right. Yeah, could Eastern medicine help? But yes, but not as quickly as Western medicine can. So let's go ahead and get on your antiviral, maybe even antibiotics. And sometimes they're going to prescribe you something for pain, and nerve pain is typically gabapentin. But we're going to get a little bit of side effects for some people with gabapentin, especially at high doses. So if you don't, you ask me why it happens, if you don't get that treatment right away, you're potentially more likely to have postherpetic neuralgia, which is the pain of the shingles rash and nerve pain after the rash is gone and after the virus has receded.
That's me. So I had shingles. I didn't get it treated, which may or may not have been the problem. But sleep, stress, all of the stuff that you talked about a minute ago that triggers, you know, shingles I got, you know, and I have this long term. Acupuncture can be a way to do what for this?
Yeah. So if I can have someone that is just 2 weeks into their shingles treatment from Western medicine, we're done in 2 more weeks. There is nothing else, and there's no postherpetic neuralgia. We can take care of the body, getting the immune system parked up to really get rid of the virus faster, to heal the skin, to heal the rash, and to get the nerves back in order, because that's what acupuncture does. Acupuncture changes the way nerves respond, and it's a beautiful, beautiful thing.
Tell me, correct me if I'm wrong, and I could be wrong. I think that when people see the rash, that's when the red flag goes up, and that's like you want to treat the rash right away with shingles, but you don't think about the stuff that's happening under the skin, right? Like for me, my pain starts here and rips around underneath my chest because it is that nerve pain. That's the stuff that can be just as bad as the rash, correct? So you're saying early treatment, pre and post is key.
So if you have that kind of burning, searing pain, and you also feel slightly fluish, you may feel like you might be getting sick. That's the real key, because this is a virus like any other virus, like flu, COVID, the whole 9 yards. You feel a little unwell. And so when you feel that burning pain, the problem is if you show up at a physician's office or even at urgent care and you just say that, the differential diagnosis sometimes is not as acute. Right. So I mean, I've diagnosed shingles a million times where I've had patients come in with a pain issue and I say, there's 2 bumps here. That looks like shingles. Let's get you to urgent care right away or your primary care right away. And then come back to me. Because if you don't get this treated right away, we're gonna lose precious time in keeping it completely resolved. With postherpetic neuralgia, it takes a lot of treatment. Even any chronic pain at all, it takes a lot of treatment. It's not like you're just coming in 1, 2 times and hey, you're better, baby. It's not like that. That's the weekend warrior, the pickleball fault you fell down, that kind of thing. We can fix you in a couple sessions. not this. This is a chronic pattern. The body's in a pattern. We have to change the body's pattern. We have to change the way the nerves are.
Well, I appreciate you so much. I know you do too. If you suffer from this, you understand what we're talking about and the importance of staying on top of it. Thank you for your solutions. Thanks for the suggestions. And if you want to learn more about this, go ahead and go to scansrq.com.